Kelly, welcome to Charleston, South Carolina.
Thank you.
Kelly is completing her fellowship in pulmonology, and I want to ask a little bit about what's been your process? How did you get to where you are today?
Sure, absolutely. Well, of course, like anybody would imagine, it's always a long process when you're in the middle of it, and then when you look back, it seems like it went quick. So I did my undergraduate education at a school just outside of Philadelphia, then went on to medical school, and then while in medical school on my internal medicine subspecialty rotations, I really fell in love with the intensive care unit. And so from that, I looked for ways that I could best get myself into an ICU career. Mm-hmm. And of course, from that grows pulmonology. So I went on to do a internship and residency in internal medicine, and then fellowship in a joint pulmonary critical care program.
So tell me about the length of time of your residency and also your fellowship.
Sure. So a year of internship and 2 of residency for a combined 3 years. And then pulmonary critical care combination fellowship for 3 years as well.
So can you break down, if one just wanted to do critical care, just wanted to do pulmonology, is there a way to do one or the other?
Sure. There's definitely individual fellowships, and the length of time somewhat depends. I think you'll find that they're often linked just because of the nature of the field, but you can do them independently, and you can put critical care onto other medical subspecialties.
Now, oftentimes people who are pulmonologists also become sleep specialists.
Sure.
Do you have that type of training?
We do have different availability to do sleep. It is now, as I'm sure many people know, its own fellowship. Mm-hmm. So it adds a year onto the training, but there are opportunities, and where I am in South Jersey, there is a osteopathic sleep fellowship available to add on.
If I was a student and I wanted to do a pulmonology, become a pulmonologist as you have, what would you recommend to them? What track should they go through in order to get to what you've accomplished?
I would say the first thing is to make sure you decide by rotating on different months with pulmonary and with internal medicine and in the ICU that you really do enjoy it, because obviously we're talking about a lengthy commitment. Mm-hmm. In terms of training. So I would say make it a priority early in your 4th year, if not late in your 3rd year of medical school, to do a pulmonary rotation, do an ICU rotation, and decide whether or not it really is for you. And the best way besides rotating is to talk to fellows and talk to other people who have done this and get their perspective on it.
What could one do in order to select a program? So maybe you think you want to live in Philadelphia. Mm-hmm. How would you go about getting a program that you wanted to get into?
If you have the opportunity to rotate out in school, that's obviously a great way to explore things. But if not, there's networks all available to you that you can speak to different people around the country, whether it's program directors or fellows or people who are in the profession. And the ACOI affords a great opportunity to do that via our Facebook, via board meetings, getting in touch with board members. Just contact the ACOI and we'll put you in touch with people who do what you're interested in and let you have an experience to talk to them and see if it really is something that you would be interested in doing, or that area of the country or a field of medicine. You know, we have plenty of contacts where we can put people in touch with different physicians or different people in training so that you get an idea of whether or not you really are interested in that aspect of what you're thinking.
In the selection process of becoming a resident initially in internal medicine, do you think it's a good idea to do the residency in an area where the fellowship exists, or does it matter?
I think a school of thought has always been that it does help. Certainly when you're someplace where people know your name, know your face, and know the care that you're providing, it does help, but it does not limit you. So if you're looking at a particular residency that doesn't have associated fellowships, you're not at a complete disadvantage. And again, you can really use the networks available to you to find out and to explore these other opportunities. Certainly it helps to be at a place where there's fellowship opportunities, but you're not completely going to be kept out of those fellowships if you're not training at a residency program where they are.
As a resident and a fellow, have you been involved in the selection process of residents and future fellows?
Yes, we, obviously get to work closely with students and interns, and so we're often looked to for opinion informally about different candidates, and then formally as well to help make decisions. So when you're thinking about something that you want to do, you always want to perform your best all the time. Besides, obviously, good patient care, if you decide at some point to change your career path, you want to make sure that you are putting your best foot forward, because even house staff that you work with do have an influence as to your future.
And probably the residents and fellows have a pretty significant influence on the program directors.
Yeah, I would say so. They're going to look to their trainees to see how people are in terms of their work ethic and just your general ability to get along with people and how you work. So I think it's certainly something to keep in mind that program directors do look to their residents and their fellows for information.
Very good. Well, thank you very much, Callie, for your time and certainly the input that you've had on the board of directors. Certainly, Callie is a future leader of osteopathic internal medicine, and we certainly have appreciated her input into the board over the last several years.